Comorbidities are very, very common in service members after TBI. Some of the most prevalent mental health comorbidities that we found was PTSD, anxiety, depression, and also panic attacks. Now, we published a paper in 2020 that was titled, PTSD is a stronger predictor of long-term neurobehavioral outcome than traumatic brain injury. Severity. I think this title sort of sums up the findings nicely, but in this study, what we found was that regardless of whether a service member had a mild, moderate, or severe TBI, and in some cases we had penetrating TBI in there as well, neurobehavioral outcome was most strongly influenced by whether those service members had PTSD or not, rather than TBI severity itself. So I think that sort of really speaks to how profound the influence of PTSD is on outcome from TBI or severities. So neurobehavioral outcomes or neurobehavioral functioning, it's a technical term or a jargon term that really just refers to a variety of mental health symptoms, physical symptoms, social symptoms, or cognitive symptoms. So these are things like depression, anxiety, anger, poor sleep, headaches, fatigue, pain, cognitive problems, explosive behavior, a lot of different things like that. One important take-home message from this study is that both clinicians and researchers must routinely consider the potential influence of PTSD on neurobehavioral outcome following TBI. Now, if they don't do this, they run the risk of thinking symptoms are caused by a TBI, when in fact they may simply be related to PTSD. Now, I'm not saying that all neurobehavioral symptoms following a TBI are caused by PTSD, but rather it is a much more complex task to determine the true cause of these symptoms when a patient has both TBI and PTSD.